know that the role of public and non-government organizations, NGOs, and charities in Ukraine is unique and extensive. Today, we have with us Nataliia Tulinova. She is the CEO of a national agency called ZDOROVI. It supplies hospitals, it mediates donor projects, and it conducts surveys of needs in near frontline regions. We welcome Nataliia. Наталія, доброго дня. Будь ласка, вітаємо вас.
Greetings, Natalia. It's a pleasure to see you. I told the participants a lot about yourself, and we can start with your presentation. Thank you, colleagues. Good morning, everybody. First, before starting, I would like to thank the organizers for the idea to develop such a nice workshop, a series of such seminars. I would like to express my gratitude to those who are present here for your time and for your interest in the subject, and to my previous colleagues, speakers, who also highlighted additionally the subject of procurements in the healthcare system of Ukraine. I hope that everybody can listen to me in the language that is comfortable for them. Yes, I confirm everything is working. Okay, so I will now start my presentation. I hope that everything is going to work and you're going to see everything. Colleagues, please confirm you can see everything and I can continue. Yes, we see everything. Okay, amazing. So, colleagues, before starting, I would like to tell you that the subject of saving lives, it appeared as a result of the actions of the events that are happening in my country now. Since the 1st of January 2024 until today, so basically 8 months, there have been 256 attacks on healthcare facilities in Ukraine, in which 39 healthcare specialists were killed and 239 have been wounded. In 2.5 years of the full-scale invasion to Ukraine, 1969 healthcare facilities suffered from attacks and destruction. Of them, 171 doctors have been killed and 527 doctors have been wounded. We couldn't just ignore what was happening in Ukraine at the beginning of the full-scale invasion. That's why we started the project of helping hospitals. Just a second. Yeah, we started helping hospitals, and for 2.5 years already, we have been working effectively to benefit our country through a network of partners and donors who finance today these projects of aid or who invest their time and their expertise. ZDOROVI was created in 2013. So we're 11 years old, but the subject of charity work was started 2.5 years ago. During this time, in 2.5 years, 2022-2023, we provided medical healthcare facilities through our network of partners and donors on the amount of $21 million. Mostly it was medical equipment, devices, and consumables. In 2024, we have $1 million for procurements of critically important and rare medicines, specifically in the territory of Ukraine. So we already buy it, procure it from distributors and the producers in Ukraine. We, as an organization, we were the first in the national contest, Charitable Ukraine, in the sector of charity in healthcare, out of 94 organizations that applied for this nomination. 2 days ago, Forbes magazine included us in top 50 most influential funds in Ukraine, and we were in top 3 specifically in the healthcare sector, in the amount of costs involved to help in this sector, in the sector of healthcare. ZDOROVI was recognized a critically important organization in the military time for the amount of their work by the Ministry of Healthcare. We have membership in SAG cluster of healthcare, which is a counseling committee that develops a strategy, financing strategy for healthcare facilities and helping the system of healthcare in Ukraine. We're also members of Coordination Council at the Ministry of Healthcare, and we are members in the National Council on the questions of sexual and reproductive health, specifically in the questions of demographic policy and how Ukrainian population could reproduce. Currently, if we talk about the figures that could confirm it, we have provided 899 healthcare institutions who received aid from us, some of them for several times. To that end, we had 2,683 requests for medical aid. On average, is 3.5 pallets to help one facility, one healthcare facility. And in total, it was 1,324 tons of aid provided to 24 oblasts in Ukraine. Yesterday, we only help frontline and the occupied territories in 2022-2023. These included all 24 oblasts of Ukraine. Currently, our donors and our partners are international UN foundations, international family funds, cooperative funds, specialized aid funds, humanitarian organizations, world famous, and also stakeholders are the ministry and institutions of Ukraine. We closely cooperate with the Ministry of Healthcare of Ukraine, National Service of Healthcare in Ukraine, Center for Public Health. We have memorandums with the Ministry of Veterans, Ministry of Strategic Development, and Ministry of Economy of Ukraine. Our partners and donors support us in several directions of our development. First of all, today we're going to talk about procurements and critical response to missile attacks and missile strikes in Ukraine. Secondly, these are projects of the monitoring and overview of healthcare facilities, also in terms of using as directed the medical aid that was provided to facilities from partners and donors, basically an audit of how this equipment is being used, whether it's being used as directed, as targeted, also free of charge. And we have a separate team that conducts this kind of audit throughout 2.5 years. We also actively do research in healthcare sector, and it has been our main priority in the last years, also with the European EBRD. And today we'll also talk a little bit more about this, how it's happening specifically this period to define the needs of the hospitals. And we also do the advocacy for the reforms, awareness raising activities for managers of the hospitals, mental health support projects in the occupied territories, and conferences, information campaigns in order to unite our Ukrainian organizations of civil society with international donors and partners, engage representatives of healthcare facilities who are in charge of decision makers for the organizations and their patients, and engage representatives of the ministries to that. Now I'd like to tell you about what you could find useful from the viewpoint, how you can find information about Ukrainian realities in healthcare system of Ukraine, and maybe deepen your knowledge about what is needed most of all and what is priority for the aid. We we conducted a sixth wave of our research, which is called the barometer. It enables us to verify critical needs, not only in the healthcare system. We also conduct them as sectoral, and we can conduct surveys to define the needs and critical needs in a specific sector, for example, in oncopathology or in perinatal healthcare. Or we can conduct this search also regional surveys. For example, we could have separate regions or communities, armadas, oblasts of Ukraine, where you could define what is needed most of all. This information is usually needed by our partners and donors who have, for example, mandates for activity in specific regions or mandate in specific oblasts. where they do their activity. The objective of the barometer is to conduct an expert survey to assess current needs. But we can also see the dynamics of these changes, because in the barometer, we can show how needs have been changing over time. You could see fluctuation in needs from what is needed by a specific region, for example, last year, to what was provided last year, so that we would avoid and eliminate overlap, duplication of the aid. This is the consolidated report on the current state of the institutions and facilities, and you could look at that both comprehensively and also across the regions. About 200 institutions participate in the survey, 180 specifically from healthcare facilities, mostly the big ones that have cluster and above cluster level, those who have 18 to 23 departments and provide surgery, have rehabilitation departments, and also representatives of the departments of healthcare. So officials from the regional and the local authorities that participate in decision making to provide aid also for medical procurements that have been discussed earlier. The results of the barometer is the very high quality and very relevant monitoring of the impact of how military operations that happen in these territories have influence on healthcare sector over there, and demonstrate, show how we can withstand and develop our aid, diagnostics and healthcare treatment, even despite the terrible conditions in which the country is now. We can see that we're not only just falling in terms of the needs that are provided better, but we can have an opportunity to develop some of the sectors, some of the directions, very specific ones, like working with wounded, for example, or working with those who amputees. It's also important to say that our research barometer, it gives access to all of our partners, all the donors who need to make decisions regarding how to help in a timely manner, which procurements should be made within the recovery projects, or how to cooperate and to have communication with the representatives of the local authorities or the government if this communication is in place. Because the consumers of the study are currently representatives of international donor organizations, about 400, those who receive our surveys, and also experts from UN funds, usually WHO and UNICEF, also independent experts who provide, who work with surveys, opinion polls in their countries, and who are interested in how, in the Ukrainian context and Ukrainian experience, who can have influence on some projects of procurements, and also representatives of the private sector and international business. You will later, when you see the contact information, you can write to us, and we will be happy to share with you the latest wave of the barometer that was published just 2 weeks ago. It's also in English, so it's going to be convenient for you. Also, our organization ZDOROVI, it has one of our activities is Grant Hub. Grant Hub, basically, it's a project for procurements both from abroad and also with the help of international partners in Ukraine. And this could have a high quality impact on the recovery, reconstruction projects, or providing healthcare facilities, those that suffered or those that are overloaded from the number of certain groups of patients there. The objective is to provide healthcare facilities with access to technical and financial resources that currently is either missing or lacking or suffered as a result of deoccupation of this region and these hospitals, or as a result of destruction and partial damage. We will now talk about two specific sectors. This is procurement that is taking place either abroad or on the territory of Ukraine, and also humanitarian response project, which is the project where humanitarian aid from partners, from donors is coming from abroad. And currently we provide aid in terms of equipment, mostly because specific medication in Ukraine, they are provided by 70%. Yes, we do conduct procurement of critically needed medication in Ukraine or abroad, but most healthcare facilities currently, also with the help of barometer, they say that the deficit in medication and consumables, it's just 30% that they have deficit, which means basically that Ukrainian hospitals and Ukrainian managers of facilities can provide adaptivity basically to the conditions in which they work now. If we talk about humanitarian response projects, this is mostly equipment and help through, because there are attacks on civilian and medical infrastructure, and we have project with the International Council of Refugees about emergency aid kits when there are massive missile strikes and a lot of people suffer as a result of that. We provide these kits that were brought from the Netherlands specifically to help such patients who are in hospitals because of these like kind of massive injuries. In terms of procurements, I'd like to tell you a little bit more detail. Grant Hub currently, with the help of our partners and donors, allows us to work in such directions which we basically defined as the most relevant and top priority sectors. First of all, these are hospitals of the occupied regions, hospitals that are close to line, that in whose communities there is still population that greatly in their structure they have chronic diseases, disabilities, or maybe some gender-based aspects because of their elderly age and cannot provide for themselves by themselves. In addition to hospitals that are close to frontline areas and the occupied hospitals, whom we provide with equipment and furniture, there's also a sector that we define them as priority areas to support and to respond to what's happening in Ukraine. So these are basically obstetrics. We are fighting for every newborn Ukrainian. This is also rehabilitation sector, because in the structure of those who suffered civilians, there's a lot of people with disabilities, with amputations. This is also psychotherapy sector. We, during 2 years, we have been providing with neuroleptics hospitals in Ukraine, almost all mental hospitals in Ukraine. And this is also emergency response to shelling aid in partnership with Americares, Philips, Razom for Ukraine, USAID, and other donors. Currently, we define 20 priority hospitals, usually of oblast level, above cluster level, and who have sufficient staff, which is very important. We provide these hospitals with aid, and currently in this period up to now, it was for the amount of 15 plus million hryvnias that medication was procured for these hospitals. Coordination in procurements. In order to have coordination and to understand what is needed for the procurement, in addition to having our barometer survey, we also use our cooperation in the healthcare cluster. We are represented there in several groups, and we can see analytics and the monitoring, what's happening on the territory, also together with other international stakeholders. We are also part of the project office for mental health support. Also through the coordination with them, we can understand what aid is needed in mental health projects. Also, we closely cooperate with the Ministry of Healthcare and National Healthcare Service of Ukraine. We can receive from them letters that would both confirm the status of critically important, for example, for equipment in several regions, or we can receive confirmation that the need in this or that region is significant. We have very high quality cooperation in MedData that Katerina has mentioned. This is very high quality platform to understand how verification of needs is happening in hospitals. We also use our own ERP system and unique reporting system that is part of the opportunity in a real-time situation to see, to watch, to observe what's happening with geolocation, how unloading is happening in specific hospitals. We have memorandums with all the departments of healthcare, and we have a representation at WHO. Now we are an NGO that is represented there to provide for understanding of needs for the WHO. How we can cooperate with you, very briefly. Well, we can together, through our experience and our expertise and our opportunities, working in the system in this 11 years to support projects to build this kind of financial sustainability and economic balance of healthcare institutions through helping them in equipment. We can also help you to verify the needs of healthcare facilities, and this will help you solve very urgent needs in communities and in the region. And currently, our donors are partners. It's free of charge for our donors. It's just our time that we are ready to spend so that you would have a very realistic and objective picture of what the sector needs. We are ready to conduct together with you and at your request a monitoring assessment of how the equipment that has been transferred is being used, or how this equipment will be used by specific hospitals in order to understand the condition of healthcare facilities now and to provide this kind of independent assessment. We work at the request of international organizations and also state structures in Ukraine when conduct the monitoring assessment. And we are ready to implement internship projects for Ukrainian specialists because our directions is not just procurement, but this is also awareness raising and the educational events. And we are ready to finance micro grants for the training of specific specializations of doctors. Thank you so much for your attention. Thank you for the support of Ukraine. Here you see part of our team that could show you our corporate logotype, the heart with a smile. These are all our efforts are aimed to support and to save Ukrainians. If you're with us, please join us. We will be a reliable platform for you, platform for aid, for help when you need to make decisions about a future cooperation with Ukrainian government or Ukrainian organizations. Thank you, colleagues. Thank you so much, Natalia, for the wonderful presentation. I think the interpreter will continue translating into English channel. In the chat, we have a question. There's a lot of interest to the barometer. And the question is how it's created and how often you publish it. Thank you, colleagues, for the question, for your interest. Barometer is published every quarter on a quarterly basis, starting from December 2022, when it was first published. It basically outlined the year of what has been happening in Ukraine in these times of the first by that time, eight first months of the full-scale invasion. We surveyed the condition as of December 2022, and we could see, for example, that the request to receive aid for critically important medication was 83% across facilities in Ukraine. 186 healthcare facilities participated in that. As of today, in wave 6 that we recently received just 2 weeks ago, we already saw that the needs, specifically in critically needed medication, dropped, and it's just 30%. This is important to talk about this because as of now, as of today, thanks to the barometer, we can help partners and donors to make very weighted decisions that so that Ukraine doesn't need everything and immediately. Ukraine needs a very rare and very critical medication, which is not in the national list approved by the Ministry of Healthcare, that cannot be procured in Ukraine because they are just missing, lacking in Ukraine, or very critical equipment and devices that had been also used to be very rare in Ukraine before, even early, because of lack of money in healthcare, but now because of deoccupation, because of medical equipment that was just stolen and from healthcare facilities that were deoccupied, and this is 20 territory of Ukraine, was 25 was in occupation, almost 20 is under occupation. So we can help through barometer to provide this relevant information and timely information. And how data is collected, we conduct surveys. There are 25 questions. They are all open questions. 10 of them are fixed as of now during these 6 waves that we had the same, so that we could see the dynamics in what was happening across the main sectors according to how our colleagues respond. The last 15 questions are the questions that could be shaped at the request of, for example, of the healthcare facilities, or at the request of the context. And the 15 new questions or requests, they can help, and they are helping now, and our partners to shape new programs of aid. For example, through requests in terms of what training for the management the hospitals need, or some maybe individual protection that they might need for hospitals through, I don't know, nuclear threats or technological strike threats, other technogenic disaster threats. So thanks to this service, we can see what is needed to prevent burnout of the doctors who have been working for basically so many years in very difficult conditions of making often controversial decisions and challenging times. So that's why 25 in-depth questions where you can't just tick, but and of course before them they have questions that are connected that this should be a person who is a decision maker, basically the manager of the organization. When they fill in the survey, if this is just a doctor, we unfortunately cannot allow them to proceed. We need to have decision makers who see system comprehensively and not just the needs of their department. This is very important for us. We need to understand how we can help on the systematic level, how our partners and donors with whom we cooperate, how we can help both across sectors, across different regions, but understanding how the system functions comprehensively. What are the unanswered questions on the systematic level for healthcare system in Ukraine? Thank you so much for your answer. I think there will be a lot of interest to barometer from our experts and members of ZDOROVI. We have another question. This is more from the viewpoint for the future. If you think about our Ukrainian hospitals, currently there's a lot of reliance and dependence on donors' help, or on help or aid from agencies. But the medical reform presupposes that hospitals would work as enterprises, basically. How do you think after the war, do you think hospitals will be able to overcome this reliance or dependence on external aid and to become like enterprises as per reform? Thank you for the question. This is a question about our ability to respond to the social narratives in which we live. I'm not just confident that we will be able to overcome this dependency that now partially exists, because currently we see how hospitals already overcame some difficulties of logistic, for example, that we had in the first months of the war, how they overcame difficulties with lack of financial provision that they had at the beginning of the war, how currently basically the system of healthcare is basically functioning from the viewpoint of flexibility, adaptability in a very right manner. And most of the representatives, even from the WHO, they mentioned that definitely Ukraine is a unique platform where the system is working, where the system wasn't broken, where it's basically efficient, resilient, and moreover, if the system is working, then all of the components will also work by providing themselves sustainably, flexibly to the circumstances. Currently, the system is not finalized, it did not collapse, and it continues to work. And also in deoccupied territories where there was a lot of destruction, there was a lot of damage, where some healthcare facilities, they just basically had to start working in other premises, but still there was recovery, there was reconstruction of these premises, and recovery of surgical theaters, and departments. And currently, these hospitals have resumed working. And moreover, if we talk about those that are located in central or western Ukraine, even more so. So yes, the answer, today we have shown the whole world that when the system works, the components will also work. But yes, today there's a big need to provide this kind of aid, which is very specific or very rare, and Ukraine has no access to it now. For example, we are not producers of high-tech devices. Ukraine produces furniture for healthcare facilities, but we are not really experts in medical equipment. So that's why this medical equipment, these medical devices, they can only be procured in Western countries. And currently, the needs in these sectors are still high. It will continue to be so because now also global experience has shown that most of the equipment can be procured also by means of it being produced by leading producers in this sector. That's why I definitely believe in Ukraine. I believe in Ukraine's capacity to balance and to adapt to any challenges.
Дуже дякую вам за
Thank you
відповідь
so
і
much for
неймовірно.
your answer, and we also believe in Ukraine. Thank
Я
you.
дуже дякую
I'm
вам,
so
пані
thankful
Наталія.
to you,
Дякую
Natalia. Thank you
організації
so
здоров'я,
much
всім нашим
to the organization
учасникам
and all our
та доповідачам.
participants and
Я
speakers.
думаю, що
And
питання, які
I
будуть у
think that
нас
the
пізніше,
questions that we will definitely
ми
have in the
зможемо вам
future, we will
адресувати
be able to
асинхронно
forward
через
them to
електронну
you
пошту, а
by
також
email and
прокоментувати у
also to
наших
communicate in
Facebook-спільноті,
our Facebook
LinkedIn-спільноті.
communities and LinkedIn
Я дуже
community.
дякую всім за цей
Thank you
вебінар.
all
І, в
for this
принципі, вебінар
webinar, and
завершений.
it's basically over.
Спасибі
Thank you
і
so
до
much,
побачення. До
and
зустрічі.
see you next time.
Thank you very much to everyone. I use the main channel to say that as well. And thank you to the translator as well. Well, this is it, but we can continue and stay in the comms later on. We have a LinkedIn group, as you heard before, and look forward to having your questions and supporting you on your Ukraine journey. Thank you so much.